Criptorchidism, also known as undescended testis, is a condition characterized by partial or abnormal descent of one or both testicles into their normal position within the scrotal sac. Criptorchidism is commonly seen in neonates, and in most cases, it spontaneously resolves during the first year of life. First, let's cover some basic physiology of testicular descent. Initially, during intrauterine development, testes develop in the abdomen. Here, each testicle is anchored to the labioscrotal swelling, which is the future scrotum, by a fibrous cord called the gubernaculum. Between the 7th and 12th week of fetal development, the gubernaculum shortens, eventually pulling the testicle down toward the inguinal canal, where they usually stay until the 7th month of intrauterine development. And finally, during the last month of pregnancy, the testes descend into the scrotum. The process is controlled by an androgen hormone called testosterone. Once in the scrotum, the testes have an adequate environment for normal sperm production, also known as spermatogenesis, which starts at puberty. Finally, during fetal development, a small cremasteric muscle develops within the gubernaculum. The main function of this muscle is to retract the testicle toward the inguinal canal when the outside environment is not suitable for testes, like, for example, when it's too cold. Now, the exact cause of criptorchidism remains unknown. Some theories suggest that criptorchidism may occur due to gubernaculum abnormalities, while others connect this condition with androgen deficiency. Cerebral palsy and conditions associated with abdominal wall defects like prune belly syndrome can also result in criptorchidism. Important risk factors for criptorchidism include family history, as well as birth-related risk factors such as preterm birth and low birth weight. Additionally, clients with some congenital conditions have a higher incidence of criptorchidism than others. These include meningomyelocele, which occurs when the spinal cord and the surrounding meninges protrude through an opening in the vertebrae into a cyst-like pouch; hypospadias, which is a condition characterized by the opening of the urethra along the underside of the penis; and congenital malformation syndromes, like Noonan, Down, and Prader-Willi syndromes. Finally, maternal conditions like diabetes and obesity, as well as maternal lifestyle factors like smoking and alcohol consumption during pregnancy, can increase the risk of criptorchidism. Now, let's switch gears and move on to pathology. Gubernaculum abnormalities can affect testicular descent from the abdomen to the inguinal canal. On the flip side, in androgen deficiency, there's not enough testosterone to complete testicular descent from the inguinal canal to the scrotum. Next, in clients with cerebral palsy, there might be spasticity of the cremaster muscle, which can cause the retraction of the testicle from the scrotal sac into the inguinal canal. Finally, abnormalities of the abdominal wall can mechanically obstruct the testicular path to the scrotal sac and block the testicular